If, as a result of one of these schemes, a person is delabeled, how can we ensure that the label doesn't creep back in again through human error, computer error, or whatever?
So we do have to ensure that the label doesn't creep in, and we have to understand why the label creeps in. So part of the behavioural package that I talked about with the Alabama study really sets out to try and address that and reduce that from happening. So we try and prevent it creeping back in by ensuring the patient understands what a negative test means and what it means for them, to ensure they're motivated and feel safe to take penicillin in the future. You also ensure it by making sure there's an authoritative letter about the negative challenge test. So the GP has confidence that when they see this letter, the patient's gone through a rigorous delabel process that is robust, and they can have confidence in the negative test. Because you can imagine, if you just get a one-line note from hospital and you're a GP that says this patient's not allergic to penicillin, please remove it from your records, you can be pretty anxious about doing that without knowing who's recommending that, why you're recommending that. So there's some of these sort of key things, or the sort of easy things, if you like, or the things we recognise as being reasons for the label creeping back in. But there's lots of other reasons that we don't understand, I don't think, yet. So it's a big area for us to do more work around.
That's useful. Now, if somebody wanted to get started on penicillin allergy delabeling, how can they learn about it? Where should they look for more information?
So in the UK now, we've got some good resources. So the BSACI, the British Society of Allergy and Clinical Immunology, have got a non-allergist penicillin allergy delabeling guideline. So that would be a good place to look. Also, the Scottish Antimicrobial Prescribing Group have published a toolkit for healthcare workers, non-allergists, for delabeling penicillin. So some of their material is good to use. And also the British Society of Antimicrobial Chemotherapy are about to release or launch their MOOC, their massive open online community learning module on penicillin allergy delabeling, and that is due out anytime sort of towards the end of October of this year. So I would start there and see where you go.
You are consultant antimicrobial pharmacist and associate director of antimicrobial stewardship at the Royal Cornwall Hospital. And this interview has shown very clearly the kind of work that you do. But my final question is this a career choice or direction that you would recommend to others? And if so, why?
I would recommend it. Yes, I thoroughly enjoy it. The reason why I enjoy it is my job is about how we change antibiotic prescribing for the better. How do we optimize prescribing, improve patient care? And some of the things that we try and do, like we'll give you an example of, reducing antibiotic course lengths, for example. So, the literature really supports reducing antibiotic course lengths for common infections, but yet we don't do it. And even if you put it in your guidelines, people don't do it. And the reason for that is around behavior change. And we have ignored behavior change. When we try to change behavior, we don't tap into the principles of behavior change. And for me, learning about behavior change has been hugely interesting. So as a pharmacist, I spend a lot of my time working out, first of all, what we need to do. That's fairly easy. We're told what we need to do. There's evidence to tell us what we need to do from good studies. But how we do it is a real challenge. It's a big, meaty problem. And that takes a lot of thinking, a lot of talking to others. It takes a lot of collaboration, which I enjoy. And, it means you work with other healthcare professionals, other healthcare worker groups. So it's hugely varied in who you work with, and the task is hugely complex and interesting to unpick. So I would recommend it. And it's not as simple, to think beyond the pill, if you like. It's not about how the tablet works, and we know all that, and that's really interesting, and that's why we get into pharmacy. But my role is around changing practice and how we work, and it's a harder thing to do, and the more rewarding thing once you've achieved it, and you can achieve it. And so that's why I enjoy it, and that's why I would recommend it.
Neil Powell, thank you very much for talking to us about this important work. That really has been terrifically interesting, and we look forward to seeing how this develops further. For more information about Mr. Powell's work, please visit our website using the links in the description, and be sure to subscribe for more news, videos and journals. For updates straight to your inbox, please follow the links below. And thanks for watching.